Thank you, Prashantji, for the introduction, and thank you, Dr. sir, for having me here for the last many years. So this topic is also very interesting for the practicing pediatrician, practicing medicine doctor, or any other person in general practice. So it is intersection of diabetes and sleep disorders. I will be touching on the emerging insights only, because in the morning we had sleep symposium, we had interesting dental talk also, we had so many interesting debates. So this is actually on a summary of what we are learning or we are going to learn in the future. So the first, I think, is the last topic of the day, I think. So it's almost like I am between you and the sleep or the food. So just like a night owl, you should never be like that. You should be like the baby who sleeps more. That is for the growth and metabolism. So before I start further, I will pay my respects to my teachers and my guru who have actually mentored me. One of them is here, Dr. RSSK President, Dr. Rakesh Sahai. Others, Dr. Sanjay Kalra, Sarita Bajaj Madam, and Dr. Nitin Kapoor. These are the scientists who have done research basically in this topic, and a new terminology has come called barophenology. So that is why I am going to talk today. The first slide you can see sleep. So sleep has no standard definition, but this is what the sleep medicine once organization has been formed. It defines sleep as an active state of unconsciousness produced by the body where the brain is in a relative state of rest and primarily responds to the internal stimulus. So previously we think it's a very passive state. So it's not passive because there is a lot of metabolism happening in that phase, and which hormones are also coming up. So that is what was disproved in 1920s by EEG studies by Hansberg. So people tell us that they are not sleeping properly. They may be in a transient tiredness phase. So tiredness is definitely a lack of energy initiative, can be improved by rest and proper nutrition exercise. And other patients have fatigue. They are not able to do anything at all. So fatigue is the extreme overwhelming sense of tiredness. That is exhausted, associated with impaired energy and cognition. So these are the closed DDs of sleep, but sleep is sleep because those who don't have sleep, they have jet lag. So that is why sleep is very important in our body. So sleep in ancient times was respected and honored. So they don't have night shift in the past. They did not have people who had air travel was not that much as much. So we are seeing modern day times, they are actually having less respect for sleep. And even night doctors also doing duty. So it's always inevitable to do that. So it's a competitive work style, digital overactivity, which I am also doing. Lot of overactive because compromised sleep time and leads to stress. So when stress accumulates, distress occurs. And this is the ancient Kumbhakarna, and you can see the modern day time. This is the extreme opposite of reality. So clinical practice, we don't take a detailed sleep history because that is why we are lacking. We don't ask them how much hours to sleep. In Western patient, you have patient where 20 minutes are given for a doctor. So I think in our times, I think we are only getting less than 5 minutes or maybe 10 minutes. So in that, how many days? How are you person? How are you patient? We never ask those. How many hours you slept? Did you have something? So that is what you should actually have a detailed sleep history in that. So in one slide I can tell you physiology of sleep. Sleep has got multiple physiological roles. It restores the cognition, it conserves the energy, it improves the immunity, it also helps to prevent so many metabolic disorders, and finally helps in the synapses and memory consolidation. So sleep is never a passive state. So trivia, maybe anyone interested, because there is a festival of sleep day. Because after New Year begins in everywhere, the first 2 days people are very active. So January 3rd is considered to be the festival of sleep day, because that is the one day which they are allowed to sleep more than usual. And there is also a sleep awareness week, where the American Association of Otolaryngology and the Sleep Association in March for the sleep. So that is what sleep is definitely getting respected more and more by known associations. So sleep is definitely a pillar of lifestyle medicine, where we had nutrition, physical activity, stress management, social disconnect, and also avoiding risky stuff. So it's a crucial restorative sleep. So just one case for you. 47-year-old gentleman complains of fatigue, diabetes, hypertension, and getting obese. Hypertension means it's definitely not controlled with the conventional medicine. At least 4 medicines have been tried. So you can see the more than the patient, the spouse is suffering. And just you can see that is what patient came with. The wife actually told that the person does not allow me to sleep. So for diabetes you can see lot of medicines are there, and he is on the brim of getting insulin also. HbA1c is not getting controlled. And you can see for BP the medicines are increasing and increasing, including dapagliflozin they tried, but could not tolerate because of genital infection. You can see the main complaint is not uncontrolled diabetes, it is about frequent snoring episodes and daytime sleep. So what can we do? So short sleep is definitely a risk factor for progression of cardiometabolic risk factors. This slide you can see here, mechanisms entail inflammation, metabolic, vascular, hormonal and genetic. So these are the conglomerate of all the factors which progressively attack on the metabolic milieu, and outcomes are very dangerous. That is coronary heart disease, stroke, CVD and death. So death in the bed syndrome is autonomic instability caused by the net effect of all this. So we have to prevent sleep apnea. So what is sleep apnea? So sleep apnea is a relative state in which narrowing of the airway occurs. That means less oxygen enters the tissues. The heart gets stressed. That is a repetitive pharyngeal collapse of the sleep resulting in cyclical hypoxemia. Finally, hypertension occurs and releasing the stress hormones. This is the ultimate effect which remodels the sleep further. So sleep apnea is considered to be a connecting link to metabolic disorders. You can see this picture. Any PGs who are here, you can definitely remember this picture because blood pressure, heart disease, obesity, diabetes. In between that, you can find sleep apnea. So any person going in for heart disease, you should definitely capture the history of sleep apnea. There is a strongest association with all these metabolic disorders. So one picture for the mechanism of action, hypoxemia or reoxygenation cyclically occurs. And finally what happens? Endothelial dysfunction occurs. When dysfunction progresses further, you can see oxidative stress and all the genetic mediators coming. So finally cardiovascular risk. So that is one of the main things where cardiovascular risk is occurring. So biologically, you know, hormone is important called melatonin. So light activates this and prevents the production of melatonin. That is why sleep is important. In sleep, you should have a silent environment with a closed, with a no light at all. So that is why we should always remember the sleep prescription. So I will tell you what is that also. Sleep is definitely important because dreams happen. When dreams are happening, you get progress also. So sleep cycle is simplified in this picture. Awake, light sleep, deep sleep and REM sleep. So that is important for the biological perspective. And we had a nutrition symposium. I want to touch on the major important nutrition cofactors. Because when a person has the correct amount of cofactors, it builds their nutrition. So you can see magnesium, calcium, B vitamins, folic acid, iron, zinc. Just to summarize there, all these are important because serotonin and melatonin are definitely getting production in the sequence of these cofactors. And one slide about the myths we should know, because the facts and myths. Some people tell you can have this food best for sleep. That like you can drink more water, you can drink some berries, there is some tea called chamomile tree, there is some proteinaceous food, but it is all myths, it is not proven anywhere. And some people tell that the worst food for sleep. I believe in chocolates, they are not very good for sleep, but some people disprove that also. But definitely sugar, alcohol and spicy food are definitely bad for the sleep per se. This brings to me the next topic which I am part of, a sleep medicine discussion called chronobiology. So chronobiology is a branch of biology that expands this into biological rhythms. So this is definitely different from the circadian rhythm and the biological clock, because biological clock is an innate timing and specific hormonal molecules or proteins, whereas circadian rhythm is the natural one. That means the eating, digestion, hormones, these are a part of the sequence of the body. So circadian rhythm is definitely an investigative mechanism. We should definitely have a difficulty measuring the circadian rhythms. So many machines called accelerometers are, that's a new insight. And definitely they used to capture 1 week pattern, just like Dr. Sir, previously Ramesh Sir had told about the ambulatory BP, and so many other people have told about glucose monitoring. Some accelerometers are there which just capture sensor mechanism, go at the bedtime. Now we also know Holter mechanism. So many similar mechanisms are for the experimental model. And they capture the amount of sleep and deep sleep going in. And they can measure other parameters also. And there is a specific haplotype called clock. And that is also with the prevalence of obesity and metabolic syndrome. The mutations of clock are getting to metabolic syndrome. So this is the accelerometer which I had shown you here. It captures the heart rate, the heart, lung sounds, breath rate, as well as the body position. So body moving across is actually normal. So that is what position is also. This is very important to estimate the body rhythm. And this is the curve in which they are going to capture this. So physical activity data in every week till the day 7. So that this way they can capture the overall pattern. So progressing further, this is what I have told you about clock genes. It's the latest insight about this. So many other genes are also there. It's called E-box and the V box, you can see here. So signals act from the VMAR or clock pathway towards the downstream. And you have some mutations in the other side, negative and positive. They are just named just for your namesake, or PER and CRY. So these are all very interesting things, but very beyond our scope of literature. This is a link because PER2 is found to be a link between the body clock and the systemic clock. So PER2 mutation is definitely bad for the overall health. So this synchrony occurs when these are all mutated. So now simplifying further, N1, N2, N3 and R sleep. So these are all measured by hypnograms or measurement tapes. You can see this is the natural sleep. Initial phase is very active and falls quickly asleep. The faster the patient goes into the N3 sleep or normal, this is actually better. That means the rhythms and cycles happen more and more. So some people don't go into the deep sleep, means the N1 to N3 does not happen fast. And REM cycle is just a small part where dreaming also occurs. So REM occurs only once and it occurs perpetuates again and again, whereas N1 and N3 actually it can happen cyclical cycle. So once it progresses to REM stage sleep, it is actually better for the immunity also. So we are finding so many people obese in the adolescent phase itself. Dr. Manikandan in the morning had mentioned one important article. This is a similar article which shows you that eating disorders, sleep duration, insulin resistance are all linked. That is how this study had proved. So that means melatonin gene forms so many things affect the cortisol pathway also. This diagram shows you the mechanism of different hormones, which I am part of the science. So we can see the natural metabolism hormones in the daytime are the sympathetic tone, cortisol, the insulin and adiponectin. Negative hormones are better in the night time. They are the growth hormone, melatonin, glucagon, leptin. That means these metabolisms hormones are influencing the sleep rhythm and activity of the future glands also. So this slide you can show disruption of the circadian rhythms has been captured in some various biological models for progression of the disease also. So some studies have done the mice model to establish this, which using the EEG locations, showing that anticipatory activity of sleep definitely affects the rhythm and central clock is independent of that. That means if you have a timed feed, if you are feeding the person correctly, because in the night time you should avoid overfeeding, that improves the daytime activity. So if you eat more in the night, that affects the daytime activity. That is proven by the mice model because central clock is definitely there. So as I told you, REM sleep is the last third of the night and slow wave is the first third of the night. REM sleep has 25% of the total sleep time. Once entered through the NREM, definitely 90-minute cycle, it progresses better. So hypnograms, not done by me, done by the sleep centers and other specialist centers, definitely they capture the awake, alpha, theta and vertex waves and progression of these waves. This is the simple diagram which you can see, slow oscillations, spindle waves, ripple, theta. These are important to capture the patient with OSA because the person goes into the obstructive sleep apnea. Remember that sleep disorders are also progressing in them. And disorders like bruxism and other malapproach are also important. They should be corrected before going for the surgery. So I will just finish off the slides now. So these are the normal architecture and the disordered architecture. You can see a severely fragmented sleep in the third picture. And the middle you can see no sleep, it's the restorative sleep. So you should have a delta wave for a good sleep, whereas severely fragmented sleep you can see there is no delta, definitely dysarticulation. So I will just finish up this section by giving one new update. That is, there is one people who believe that there are different chronotypes between the PR gene. So those who sleep less, that are night owls, they have shorter PER3 genes, and early birds have a longer PER3 gene. So Chako sir wakes up early, so he will have a longer, that is good for life or longer life also. So night owls leave less energy and early birds need more energy. And this is another field, that dolphin type, lion type, bear type and wolf type. So in this way activity has been captured further. So this is the very important thing which our patients do tell us. I will finish up the slides. So dysbiosis or gut biome is another update because changes in gut microbiota affect the obesity, also the sleep. So these are the healthy gut microbiome and the obese gut microbiome because these are changing with each person traveling more. So they get more different exposure to gut microbiomes. Latest player in this is the adipokines. These are leptin, visfatin. These are important because leptin has to reduce the airway obstruction and improve the hypoventilation. This is the way in which they progress towards the obesity and the inflammatory pathways. These are the pro-inflammatory adipokines and the pro-inflammatory mediators. So this is important because they progress towards even cancer, because if patients go in for more of these repetitively, they can actually prevent the progression of autophagy and they can actually help in the production of cancer. So it's very important because obese individuals long term can have a risk of cancer. So I'll conclude by telling about barocrinology. This is a novel terminology. Baro means weight. So crinology means endocrinology. So these four people had gone together and developed a consensus statement and comprehensively, because weight loss therapies also influence the sleep patterns. There are also a term called somnometabolic syndrome. We have heard about the metabolic syndrome. Expansion of this, including OSA, is called somnometabolic syndrome. So less sleep, reduction into all the other phenotypes like PCOS, late onset of hypogonadal system, and heart failure also. And last is the ABCD. So adiposity related, that is the ABCD. So that is also the obesity. So it progresses towards the long-term risk. So there is a U-shaped relationship with the sleep and the diabetes. When you have a less sleep, very less and higher sleep, it is actually bad. You can say relative risk of sleep more than 8 hours is 3.63 and sleep less than 5 hours is 2.6. That means definitely you should have optimum sleep of 7 to 8 hours. These are the mechanisms linking sleep apnea with glucose intolerance, weight dependent and physiology dependent pathway. Whom to screen for OSA, we can see here, witnessed apnea as the first patient, morbidly obese, more than high BMI, uncontrolled hypertension, congestive heart failure, and planning for bariatric surgery. Whenever you are planning for bariatric surgery, you should definitely work with them up, then only go for a surgery. Some questionnaires are there which are capturing the different ways of sleep. That is what Stop, Bang, Epworth, we know. Actually, we are all familiar with that. This is a sleep study, how we can diagnose sleep disorders. And we have our electrodes, overnight fasting, TST is what we do, multiple latency test. So this is what centers typically do that. And indications are multiple and there are various ways of sleep study which pulmonologists do. Sleep, they have got different methods also. They have scoring, got severity based on the ASI, so that you can see here, AHI index, because mild means 5 to 15, moderate means 15 to 30 and more is severe. So finally guidelines. So once heard about what guidelines say. Currently, diagnosis of OSA should be confirmed by a sleep study, validated correctly by a questionnaire, and you should go for the AHI score. Then based on this, you should try with CPAP. If CPAP is rejected, you should go for other titration therapy. So there was the world's largest sleep study conducted about 2 years back, and definitely they had promised to give more. I think they are getting published only. Upcoming, there is a literature on hypoglossal nerve stimulation, and that is actually because activating of key muscles of the dental pathway is also important for the sleep. So last about solutions, what we can offer is the sleep prescription. So I will conclude. So sleep prescription means you should give them a regular sleeping hours, ensure the environment is correct. Do not go to bed unless you are definitely needing to rest. Don't spend too much time in the bed. In the bed, avoid the electronic items, and also napping is actually beneficial. If you have a night sleep moderate in the afternoon, power nap is also beneficial sometimes. And exercise should be done in the day for this. Avoid alcohol in the night time and avoid sedatives as much as possible. That is what we should definitely tell our patients. And it counsel them about benefits of sleep and the hazards of sleep deprivation. Whenever you have prescription, tell them about these both things also. Summarizing my slides, my dear friends, sleep is definitely a metabolic regulator. Sleep debt is actually bad for the carbohydrate metabolism. When you diagnose sleep disorders, it is rewarding because you can definitely give them a good outcome. OSA and sleep, diabetes have got a two-way relationship. For this, we should definitely manage with weight and CPAP. So I thank you for the listening. You can always reach out to me. Thank you.